Let's Go is a great program. We work to increase healthy eating and active living for kids wherever they live, learn, work, and play. And we work all over the state of Maine in 1,000 different sites, in schools and child care centers and doctor's offices and after-school programs. And it's just an amazing program because it looks different everywhere we go. I mean, there's new school gardens coming up, and that means the kids are they're planting the food, and then they're eating the food that they planted. We have more physical activity breaks happening everywhere. Well, the doctors play an important role because they deliver a message 5210. It's 5 or more fruits and vegetables a day, 2 hours or less of screen time, 1 hour more of physical activity, and 0 sugary drinks. And that message that the doctors deliver in their office gets delivered throughout the community and all the different sites. I've done a lot of quality improvement work and a lot of work over the last 20 years in pediatrics, and oftentimes doctors will just do an asthma program in their office. They educate one patient at a time. And what Let's Go does is very different, and what the role the hospitals have played is to take it from one patient to more population into community health. And that's the role that our hospital and other hospitals throughout the state of Maine are doing, and any hospital in the country can do. The hospitals have a role to play in community health, and I think Let's Go is a great example of that. It's often hard to measure these kinds of results. So we have developed, I think, a very thorough evaluation plan where we look at all the sites. We work in 1,000 sites across the state of Maine, and what we do is we measure that the environment has changed. We measure that there are more school gardens. We measure that their food isn't being used as a reward. We measure that there are more physical activity breaks happening. We also then measure whether there are policies that are being enforced in all those sites to make sure that those good strategies that got implemented in September are still there in May. Third, we look at behaviors. We use some surveys that happen in the school setting to see whether kids are doing the 5210 behaviors. And lastly, we look at obesity prevalence rates. And what we found over the last 8 years is that environments are changing. There are strong policies to enforce those environments. The healthy behaviors are starting to really change, which is really exciting. And obesity prevalence rates seem to be stabling off.